Hi, my name is Felicia, and I'm going to present a scenario. Imagine yourself feeling stomach pain. You're dizzy. You have nausea and shortness of breath. So you decide to go to the emergency room. You tell the staff when you get there the symptoms that you're feeling, but they're not understanding you. So you again try to explain yourself the symptoms that you have, but they still don't understand you because they don't speak the same language that you do. According to the New England Journal of Medicine, 49.6 million Americans, which is 18.7% of the residents, speak another language other than English in their home. 22.3 million, which is 8.4%, are limited English proficiency, which means that they only are able to understand or maybe speak a little bit English, but it's still limited. In the University of California, they did a research including 4 states, and 35 cases were found to identify that a language barrier resulted in harm to the patients. Many cases resulted in irreparable harm and or death. I would like to speak to you about the importance of learning Spanish in the healthcare industry. At the end of my speech, you'll be able to understand or have an understanding of the benefits of learning Spanish, and it will be able to help you take action to save patients' lives. I'll be discussing, do healthcare professionals benefit? Would the community benefit? Are there consequences? Now that I've stated the 3 main points, I will start with my first point. Do healthcare professionals benefit? English is a primary language in the United States, so why would it benefit me to learn Spanish? Well, Spanish is a secondary language spoken in the United States, and it's stated that it's going to increase throughout the years. Well, if we have an interpreter available, why do I need to speak Spanish? You are able to use a medical interpreter, but there is still a high probability of omissions, of incomplete histories, or misunderstandings. So you're not 100% accurate that the information translated or interpreted is correct. Well, it's the patient's choice if they want to learn English. They are able to learn English, but Spanish speakers are loyal to their native language and are able to relate openly with the healthcare professional in their own language. So it helps with the medical professional to learn Spanish, to be able to build those relationships with the patients, and so it helps them to have a better and to be able to provide better patient care. Now that I've stated the benefits of the healthcare professional learning Spanish, I will speak about the benefits of the community. So 29% inflow from Puerto Rico was recorded between 2005 and 2016, according to the Bureau of Economic and Business Research. 28.3%, according to the U.S. Census Bureau, speak language other than English at their home, which is rising. And then it also benefits the community that the healthcare professional knows Spanish, because it increases in health in the community. So communities are healthier because they're able to have the relationship with a provider that knows Spanish. Now that I've stated the benefits of the community, I will discuss the consequences of not learning Spanish. A consequence is harm to patients' care. So it can be delayed diagnosis or misdiagnosis. In the research done at the University of California, a child went to the emergency room with some symptoms and they were misdiagnosed with strep. So it delayed, because of the language barrier, it delayed the correct diagnosis, which was Kawasaki's disease, and it resulted in damage to the child's organs. Another consequence is malpractice claims, so millions in lawsuits. In the same study done, the 35 claims reviewed, the malpractice carrier paid $5 million in damages, settlements, and legal fees. And then another consequence is death. So because of the language barrier, it can result in death of not understanding the medications or the procedures that are needed. Now that I've stated the consequences of not learning Spanish, how many of you will sign up to take Spanish classes? Of those, thank you. Of those that did not raise your hands, how many of you will consider at least taking Spanish classes?
I have like the app. But I've taken up the Spanish like 4 and took it in college, so I know a little bit.
All right, thank you.